Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. Some diseases can be a challenge to control, including the one we're focused on today, diabetes. But with knowledge and effort and discipline, diabetes can be managed and even reversed. Today, we'll introduce you to a woman who took control of her diabetes and her life. We'll also meet the two diabetes specialists who equipped her with the right knowledge that is keeping her healthy today. And here with us in studio is Linda Tagge, who admits she used to struggle with type 2 diabetes, but doing some things different changed that, right, Linda?
That's correct.
Good to see you.
Thank you.
Interested to hear your story. I'm sure you have lots to share. We also have Dr. Kristen Gordinobots, endocrinologist and director of the Cray Diabetes Self-Management Center here at the University of Kansas Health System. How are you?
I'm doing great, thank you.
Good to see you. And Patty Leoit, a nutritionist, registered dietitian, and certified diabetes educator. Always good to have you. Not to mention, you're a pretty darn good cook.
Thank you.
Well, you're going to share a good cookie recipe for us later on in the episode.
Yes.
Promise? Okay.
Yes.
Well, let's start though with Linda. You were diagnosed, what, 10 years ago? Is that right? Mm-hmm. How did you end up getting diagnosed?
Well, I was in the hospital because I'd cut my finger off, and they ran the glucose at that time, and it was above the normal. And
what did you think when you get this?
I thought they were just joking because there's no diabetes in my family. I thought, what? You know? And so I started following up with my regular practitioner. I said, well, this is what I was told at the emergency room. So he would monitor it periodically. Sometimes it was good, sometimes it wasn't. So I just kind of dismissed it.
So you had this high glucose,
Mm-hmm.
but you hadn't officially been diagnosed with diabetes until you saw your doctor?
Correct.
Okay. So you told us that managing, though, the diabetes was a struggle at first. What were some of those big challenges, other than just digesting that you now have this and something that you now have to manage?
Yeah, the challenges were that you get very sluggish, you know, and your thinking process gets very clouded sometimes. You get confused. And I would think, well, maybe I was just too tired because I was taking care of my mother at the time, 24 hours. But it was challenging because my weight would fluctuate, my feelings wouldn't. Just like I said, strong days I was good, other days I was very tired, and I just couldn't figure out why, other than I thought it was my mother taking care of my mother. You know?
Let's be honest. I mean, how often are we not tired or feeling
Correct.
foggy, or you know, it just feels like that's something you would confuse with just regular old life, right?
Right. And even with the exercise I was doing, it just never seemed to. My weight would just keep coming up and going up, and you're like, why? What am I eating? You know, I thought I was eating things correctly. That wasn't the correct. That wasn't right. I was eating everything the wrong way, and the wrong things.
Well, you shared some before and after photos, so I want you to kind of talk us through these, if you would.
Okay. Yeah, that one that was when I was packing on. I love pasta.
Who doesn't?
Yeah,
Hello.
And, you know, I had no idea that it was a very bad starch. I mean, you always heard, don't eat carbs, don't eat carbs. Well, that's so hard to do in this day and age. There's carbs everywhere.
Yeah.
And so I didn't really realize what carbs I could eat in the order to eat them, that it would be healthier for me and wouldn't end up the way I was there.
So you, the picture on the left, if we can bring that back up, was this before you were officially diagnosed?
Yes.
So then we look at the picture on the right, and what had you been doing from left to right to get there?
I got into the Cray Diabetes Center because what they did, Dr. Godernovac actually listened to what I was doing every day in my life, you know, where I was going, what I was eating, what I was doing in exercise. She actually paid attention to what I was saying, which made me feel like there was hope I was going to get control of this diabetes. And then COVID hit, of course, you know, and that became a real challenge to get into the center and things like that. But she ended up sending me to a nutritionist, which was amazing, because she got me into the direction of eating the right starches and the right proteins, you know, no fried chicken, no,
Ever?
no deep fried. No, actually, that's what I love about this program. This was something Anna said initially was, you don't have to stop eating carbs. It's how you eat. So she taught me how to eat my vegetables and my salads first, then my protein, then those bad starches.
Right.
Because by the time you get done eating the good vegetables and salads and the protein, you don't have the cravings for those bad pastas and potatoes. I wasn't a sweet eater, which cookies look wonderful, but I'm not somebody for pasta, you know, for pastry. I'm more for a steak and potato lady.
Oh yeah, right. Love it. So Doc, let's talk about that, because I'm sure there's a lot of patients that feel the same way that she does. You know, you think you're eating right, or you think, well, I don't eat that much pasta, or, you know, I don't eat that late at night. So tell us a little bit about the process and how she's doing and what kind of advice you give other patients.
I mean, Linda's doing fantastic. I'm just her biggest cheerleader over here. But diabetes can be really overwhelming. It's a lot. Even years and years after a diagnosis, it's still kind of confusing. What should my blood sugars be? Remembering to check your blood sugars. What can I eat? What can't I eat? Remembering to move our bodies and to be active. And so it can get a little overwhelming, but you know, there's a lot of resources, and we got Linda into a lot of resources through the Cray Diabetes Center. It really is first and foremost lifestyle management, and that's what we try to teach patients, is give the tools to empower them.
And you said, you know, it's a lot to remember, so much so that you have to carry a binder. Tell us about the binder.
Let me tell you, this binder I got from the Fresh Start class, and I want to tell you, it's got the best references and suggestions what to do and what not to do, how to eat healthy, what starches to eat, what not to eat. Where are the resources? If I have a question, I can give a call to the office. It just gives me, I mark it so I can see the goods and the bads. And then because of that, I feel more comfortable eating now, because I know I'm eating it in the right order. I'm eating the right things that are really good for you, which I love to cook too, just not cookies, but your cookies are great. But it's just, I had no idea the order in which you eat food and the type of foods you eat can be so beneficial to your diabetic life.
Nice when you have a patient who carries around a binder with all the right things to do.
That's above and beyond.
We like it. We like it. You said you take it everywhere, and I love that you brought it right here on the program. How do you define controlled versus uncontrolled diabetes?
Well, the most familiar way that people can define controlled and uncontrolled is through an A1C measurement. So that's the average blood sugar over the last 90 days. But we also want to look at time in range, especially with our newer devices like the continuous glucose monitors. It's really important to keep our blood sugars within a certain range for most of the time. We're also working on controlling other aspects of the body, because diabetes affects more than just the blood sugars. It's what the blood sugars are doing to the rest of the body. So we really want to focus on cardiovascular health, keeping blood pressure, cholesterol at goal, and those regular routine visits for eye checkups, monitoring kidneys, things like that.
Yeah, diabetes has changed a lot since my grandmother had it, and I remember sitting at her kitchen table and just pricking the finger, the blood tests. Linda, you actually have a device on your arm, if you wouldn't mind showing us. You said your phone, your cell phone may even go off to tell you.
Yeah, to tell me it's time to, oops, can't get that up there right now. There you go.
There it is.
And how much of a game changer has that been? Because you don't know, because you don't really prick your fingers. You don't know
I
how
don't.
to do that.
But what is nice is it's an app to the phone, and it will tell you periodically when they want to check it. Whereas before, when I used to stick my finger, I would have good readings and everything looked good. But then when I'd come to the office, their A1C didn't match with what my readings were, and I was very confused, thinking, where's the problem? But this device helps me look at it any time of the day and at night, which we found out it was really spiking at night while I was sleeping, whereas I learned through this program here, have as much as a little cup of yogurt and maybe some nuts on it about an hour before you go to bed, and it's been wonderful through the night.
It's controlled.
Yes.
Doc,
very much so.
how accurate are these devices compared to the blood tests?
They're fairly accurate, and the nice thing about these devices is you can see patterns and trends. You know, when people stick their finger once to 4 times daily, that's just one snapshot in 24 hours. And so really seeing these trends can help us evaluate where patients need that extra help. They're also a great safety device because they can alarm you when you're dropping low, and they also alarm you when you're going high.
Let's talk about the Fresh Start program. Is this something, a program that's been offered to Linda?
Yes. Through the generosity of the Cray family, they help support our diabetes programming, and they've made so many resources available to our patients, and we're so grateful to them. And one of these programs is the Fresh Start program. So this is a 24-week intensive program where patients can have intensive visits with a diabetes educator, a nurse practitioner, as well as really targeted group classes. They can have continuous glucose monitors, and we keep track of them for 24 weeks, providing that encouragement. The goal is to really just give them the right tools to kind of get on a fresh start for managing their diabetes for long-term success.
So Linda, as the perfect patient you seem to be, how has this helped you, take this to the next level of really managing your diabetes?
Very well. I mean, you couldn't ask for a better system. Like I said, when I would prick my finger, I would have nice looking readings, but that wasn't what would show up when I'd go visit Dr. Gadernevak. And with this device, it actually shows me when it spikes, what was it? It makes me think, what did I just eat that caused it to do that? You know, what time of the day did I do that? And like when you travel, oh my gosh, it shows how terrible. When you're not active and moving, your glucose will go up.
So it responds to your behavior.
Absolutely. You know.
Patty, thanks for hanging tight with us. I want to bring you in here because your food tips are always something any of us can use. But some of the things that you've heard Linda talk about, just is she on the right track? What is she doing? What was she doing that one could stay away from? What could she do better? So on and so forth.
One thing that I like what Linda mentioned, which she works very closely to by the other educator, Anna Newby, who she's leading the Fresh Start program. You mentioned about that now that you feel more comfortable eating, different kind of carbs. You can still eat pasta, but by combining with vegetable, your salads, your protein, and you try to eat the high fiber food first and protein first, and then pasta later. So that's how make it when it's go through your body, go through your digestion, it slow down digestion. Therefore, it's slow down the spike up of blood sugar. So it's better, to incorporate complex carb with lean protein. You mentioned about yogurt, and having a healthy snack with high fiber and good fat, can help maintain post-meal blood sugar better. And also you mentioned about you also utilizing the CGM data, to confirm or reinforce the good behavior. When I eat something like this, my blood sugar seems to be better. When I'm not active, I notice that my blood sugar tend to spike. By walking after meal can help lower your blood sugar. And it's a very good reinforcement, whether the positive reinforcement when you're eating a real food, whole food, complex carb, or whether when you're not moving and then your blood sugar's high, that would be the negative reinforcement that make you think about what I can do better next time when this happens.
Yeah, we talk about the balance of life, but like no truer than when you're talking about managing diabetes, like really trying to figure out how that scale tips and doing those right things. What else are you offering patients, Patty, when they come to you? What are there any common questions, any common challenges that people run into when it comes to their diet?
So beside the Fresh Start program that Dr. Gary Novak and Anna Newby and Amanda Williams are running, we also have a full team of registered dietitian and certified diabetes educators like myself, offering one-on-one as well as the group classes that go through basically same material that Linda brought today, to go through talking to the patient, helping them navigate through diabetes plans, right? When they come to see endocrinologist, doctor, or APP's provider, they go home with the plan. Now, when they come back to us, we sit down and talk about, okay, how can you monitor your blood sugar? How can you take medication? A lot of time people, we talk through how they eat. And sometimes people would tell me, say, I eat snack before I go to bed. So I would just, ask them, say, can you tell me why you take a snack before you go to bed? Sometimes they say, because, I'm afraid that my blood sugar may drop overnight. So then, I talk to them, so then let's talk about your medication. Let's reach out to your provider, because eating to prevent your blood sugar low at night, it's not a good thing, because especially if you want to try to lose weight too. So then we often reach out to the doctor, say, hey doc, the blood sugar's dropping. This patient's afraid, that's why she needs to eat a snack. Sometimes people will say, I eat snack because I'm hungry. So then we talk about how to eat good dinner to prevent yourself to be hungry.
But what about Linda's snack of the yogurt and the nuts before she goes to bed sometimes? Is that good? Because sometimes I do that. I go straight for yogurt when I'm hungry before I go to bed.
I think it all depends on why you take snack, right? Sometimes people take the snack so they can sleep through the night. And as long as the snack is very low carb, like for example, the no sugar, you say no sugar yogurt and add some nuts, which have a relative low carb and also have a lean protein and fat that can level the blood sugar overnight. And that's absolutely fine. But the things about eating snack overnight, it's a lot of time people do because they fear that their blood sugar is going to drop. So then we fix it before that happens.
Gotcha.
Right?
Okay, so that's great advice for all of us. And another thing is that you don't have to just be a patient like Linda. Anybody can access your expert advice. You post a lot on this website called cookingwithcray.com. New recipe every month. People can sign up for cooking classes there. And as I said at the top of the program, we wanted you to highlight one of your recipes, because this is one that can keep you really full, really healthy, low carb, low sugar, pumpkin seed walnut cookies. Your video is online right now, correct?
Yes.
Okay, so tell us a little bit, let's look at the ingredients and just walk us through this and why these ingredients matter.
I actually did this recipe last month during the Cooking with Cray demo, which is happen every month. The next one actually happening this coming Wednesday at noon. You can still go to the website and sign up to join me live on Wednesday. So I use whole food and raw food ingredient in these cookies. I use pumpkin seed, adding walnut and flax seeds to add even more fiber and healthy omega-3 fats. I use natural sweetener. This recipe I use maple syrup.
So no raw sugar, lots of fiber.
Yes, the maple syrup can help bind this recipe very well. I actually found the recipe on social media and I adapted it, add more walnuts and flaxseed to add even more healthy fats and fiber. So by combining the carb, even though it has a sweetener, this sweetener have low glycemic index, along with fiber, along with fat, can help slow down digestion, therefore slow down the post-meal blood sugar spike.
All right, the key to all of this is the nutrition. Let's bring up the nutrition facts and tell us what we're seeing here and what really stands out. I'm seeing low carbs, good protein, decent protein for a little cookie, right? If you pop a couple of those.
Yes. So I actually sometimes I have 2 of these cookies for my breakfast with coffee. If I need something very quick, it will. I stay full all morning, feeling no hungry because it's very high in fiber. It very slowly digests throughout a morning. If you're gonna have it for a snack, I recommend 1 for a snack.
Have you tried making some of her recipes?
Not yet. I just learned about this website.
Oh, good.
And when I looked through it, I thought, man, there's a lot of things I could have used.
You can still join me on Wednesday.
I know. I love it.
Come,
It's good stuff. It's good stuff. We always love having Patty on with her good tips. Okay, so Dr. Gurdinabat, so a lot of people with diabetes, we know the numbers are trending in the wrong direction, unfortunately. Your services are high in demand. In fact, in 2019, reports from the Association of American Medical Colleagues colleges found that in the state of Kansas, there were 47 endocrinologists. That is 1 endocrinologist for every 62,000 people in the state. Just help us understand, when does diabetes, when do they see an endocrinologist? Can they just go to their regular doctor? What do those numbers really mean?
Yeah, absolutely. So about 1 in 10 people in the United States has diabetes, and so that's a lot of Kansans. But diabetes management is really started in primary care. Internal medicine and family medicine are terrific at screening for diabetes, counseling, and trying to prevent diabetes if someone has impaired glucose tolerance, and then initially treating diabetes. Patients are typically referred to an endocrinologist if they need some extra help, if their A1C is out of control. We see patients on insulin pumps or those with type 1 diabetes, and so we're around for all the extra tricky things.
Extra tricky things. That kind of sums that up. What other patients do you see as an endocrinologist?
We see patients with thyroid disorders, bone metabolic disease, pituitary tumors, lots of stuff like that.
Lots of stuff
Hormones.
All right. Well, if you have questions, like I do, use the chat on YouTube, Facebook. You can tweet us or email the Medical News Network. Info is right there on your screen. But let's get our COVID count from Dr. Dana Hawkinson this morning. How are you? Happy Monday.
Hi. Good. Yeah. Happy Monday. It's been nice. It was nice weather this weekend, too.
I know.
Right now, the COVID count isn't too bad. Have increased a little bit the last couple weeks. We are up from 19 cases last week to 20 cases this week. So a small amount of increase in the number of active cases we're seeing at the health system.
All right. So, of course, you're watching COVID here in our community and our country, but you're also keeping tabs on another virus.
Yeah.
There have been a few headlines recently about the Nipah virus in India. They've had 4 outbreaks in 5 years. Most people haven't heard of this virus, including myself.
Yeah.
So 2 questions. What is it, and what are the chances that we'd ever see it outside of Southern Asia?
Yeah, I mean, it is, again, another virus that is transmitted probably from a bat reservoir. There are intermediate hosts such as pigs. And I think this is one more example of humans encroaching into nature. So the bats typically feed on these fruit or date trees. They get their infected saliva on there, or urine or feces, and then the fruit can drop and can either be picked up and eaten by humans or pigs. Most of the cases that we have seen in India have probably been started by people who were breeding pigs and caught it from their pigs. But this is just another virus that can have some devastating morbidity and mortality. Can have respiratory symptoms like cough, sore throat, fever, but also can progress to encephalitis or central nervous system infection, and fairly high fatality rate. Now, could we see cases here in the United States? We certainly could. It certainly is most likely not going to reach any pandemic levels like COVID-19. It is spread mostly through body fluids, so again, that's like Ebola as well. So it's spread a little bit different, so we don't expect it to have a large impact such as COVID-19 did, but we know that in those communities in India where they have seen cases, they are taking extreme precautions, testing a lot of people and monitoring them as well.
All right, Hawk, thanks so much.
Yeah.
Any reporters with us today? All right, let's get to our community questions. And Hawk, I'm going to stay with you and let me know your thoughts, and then feel free to bump it back over here to the table. But Maria wants to know if your type 2 diabetes, if you have type 2 diabetes and your blood sugar level is not good, is it a good, or your blood sugar level, is it a good way to tell if you have COVID-19? Have you seen any correlation between these two things?
Well, I'll certainly go to my endocrine colleague over here, but certainly we know that different types of illness and different illness states can alter your typical blood glucose levels. So we do know that that is true. I don't know that one infection is pathognomonic for another, but we know that just any type of acute illness, especially infection, can alter those blood sugar levels.
Dr. Gordinova?
Got it.
Oh, good, he did it.
So I looked to her, so
Anything to
our
add?
expert here.
When people are ill, any kind of infection, illness, we can definitely see a rise in those blood sugar levels. It's important to understand sick day rules and how often to monitor our blood sugars when we're not feeling good.
Good question. Okay, so Yen Liang wants to know, do diabetes patients have a higher likelihood of developing ketoacidosis?
Some can. So uncontrolled diabetes and very, very high blood sugars can progressively lead to diabetic ketoacidosis over time, and that is something that patients come to the hospital for, and we treat them here.
Another question, is there a connection between diabetes and insulin resistance, and do they test for insulin resistance in diabetic patients in the U.S.?
So diabetes is insulin resistance. I like to think about diabetes like on a spectrum, and so you either have insulin deficiency or, on the other end, insulin resistance. And how this comes about is that our cells just don't manage the insulin well or effectively, and our blood sugars go higher, and our pancreas is pumping out more and more insulin to try to lower our blood glucose. And at some point, the pancreas just can't keep up. And so that is the insulin resistance, the resistance to your pancreas giving you insulin to lower your blood sugars, and that results in high blood sugars that then have all those downstream effects to other organ systems.
Erin has a question. Linda, do you ever check your toes or feet for sores?
All the time.
Okay, tell us a little bit about that.
Well, I watch to see if my feet are drying and cracking, because I don't want them to ulcerate in any way to where I might lose my lower limbs, which Dr. Gordinova has warned me about. This is what you should watch for every day, because if you step on something, if you don't have feeling in the bottom of your feet, I do, I'm very fortunate. But if you don't, and you step on a tack or something and don't know it's there, it can really become infected, and you may not be able to save your lower limb.
Jake has a question. Dr. Gordinova, what do you think about the new drugs like Wegovy, Mounjaro? Are they good to prescribe? Who is a good candidate for those, and who may not be?
Yeah, I think they're great drugs to prescribe. They can be really effective tools at managing diabetes. They can lower blood glucose. They can help with weight loss. Mounjaro is approved for patients with type 2 diabetes. And so those can be prescribed to, certain patients that don't have any of those risk factors or contraindications. They're not for everybody, but they are great tools for a lot of people, and we do prescribe them in Cray Diabetes Clinic.
We get a lot of questions about that. How often do you have to see the doctor?
I try to see her every 90 days, if she's got a spot. If not, I'll see her assistant, or you call them the nurse practitioner.
Yeah,
who are great
right,
also,
yeah.
which is closer to my home sometimes, so it's nice.
Good.
But I keep on top of that. It's very important.
All right, let's get to our takeaways today. Patty, I'm going to start across the table with you. What do you want folks to know?
Just related to the lifestyle modification, we were talking about how to monitor your blood sugar. Medication can help manage the blood sugar, but lifestyle modification, including the being active and eating the right food in the right order, is going to help you be able to manage your blood sugar in the long run. So it's, if you can work out or exercise or walk 30 minutes or more at the time, taking a walk like Linda 15 minutes after meals, it can help lower your post-meal blood sugar. So don't underestimate the baby steps.
Baby steps. Always have great tips for us, Patty. Thank you so much. Doctor, what's the takeaway today?
I think really just with diabetes, it really is lifestyle modification, and it takes sometimes a village to help with that, with our dietitians, our nutritionists, our advanced practice providers that also help us see patients. But it's also really individualized, and so one program doesn't work for the next person or the next person, and that's actually a really fun thing, because you can you don't have to eat a certain specific diet, or you don't have to do this certain specific exercise to be successful. You can modify these lifestyle adaptations to what fits your diet, your schedule, and still really have good success with managing your diabetes.
And enjoy your life. Linda, what do you want folks to take away from your story?
If somebody tells you have diabetes, take it seriously. Don't ignore it, and just listen to what they say. And particularly when you have a doctor like I am blessed to have with Dr. Godernovac, is when you have one like that that really listens to your problems and watches what your glucose is doing, listen to what they say to correct it. Utilize your resources, which I'm so blessed to have, because a little thing like a 15-minute walk after every meal will bring down just your triglycerides and the glucose, which I did yesterday. It got to a level I didn't like. Went out for an hour walk, and it was down. I mean, down to where it went off, saying it was going down too fast. Exercise. Eat the proper food in the order it should be eaten, because it's so easy to get away from those unnecessary carbs.
I think Linda could teach a class or something. She's like so educated on what's going on with her body, right?
I'm going to recruit you for the next batch.
I think so. I love patients sharing their stories, so important, but then just doing it right and really diving in and wanting to get the best result.
I'd like to say one thing is that when you have a team like this that really cares about their patients, and they just don't say, hey, what'd you do today to get off, so high in your glucose? They really care. They really study their patients, and they'll help you get a restart. Just like she said, it'll restart you, and it has, and I've lost a substantial amount of weight with just this 90-day issue, and I'm on the right path now. I'm back in the right lane, and I know where to go and keep going, because I've got all the resources indefinitely. So I thank them all for their time.
Congrats on your success. And again, thank you for sharing today. Thanks to all of our guests, and thanks to our viewers for being with us today. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update. When John Cook collapsed on a routine jog, strangers saved his life. Strangers who knew CPR. I'm Jessica Lovell. On the next Morning Medical Update, we reunite John with the woman who saved his life. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.